Hannah Johnson with the National Network of Public Health Institute, NPHI. Welcome to the Public Health Improvement webinar series. I want to note that in the upcoming months, we will be moving to a quarterly schedule of holding these public health improvement webinars. But thanks for joining today for the National Public Health Performance Standards version 3, What's New with the Tool for Improvement and Accreditation. So this hour, please type your questions and comments in the chat or the Q&A boxes that you'll see on the right panel if you're logged in on the web platform. If you have any issues, reminder email that we just sent about an hour ago, please contact Melissa Shota, and she can help you if you're having issues logging into the system. So in your comments throughout this webinar, I'll read them out at the end, and presenters or anyone online that may have something to share can contribute to the conversation and discussion. As you may be able to see, I've posted a link to the presentation slides here in chat box in case you're wondering. And I have a request to all of you. If you see a few questions towards them in just a minute, so at the right-hand side of the panel, I have just a few questions for you while I talk. So these are always recorded and will be available on the NPHI website. So now it's actually 0 to the hour. I'm going to get started. And we have a lot to cover, so I'm going to go quickly. Bear with me. Welcome to Public Health Improvement Webinar, National Public Health Performance Standards version 3, What's New with the Tool for Improvement and Accreditation. Here we've got planned for the hour. I'm going to kick off by talking about what the performance standards are. When I say performance standards, I'm going to use the National Public Health Performance Standards, Performance, and NPHPS, all interchangeably. They're all the same thing, and that's what we'll be talking about. They are, how they're used for improvement and accreditation, and what's new in the version 3 instruments. And then we're into the national associations who have contributed to developing version 3 instruments and materials and reporting tools that go along with each. We'll hear from two practitioners, Deb Scholten and Mitzi Racine, with experience in the local and governance entity assessments, and end on a Q&A and discussion. So first, a little bit about Deb and Mitzi. Deb Scholten is the Health Director of Northeast Nebraska Public Health Department since 2002. She led the MAP process, the Community Health Improvement process, in her Ford County Health District in 2007, and then again in 2012 and 2013. And she also served on the CDC re-engineering of the performance standards, which helped develop the version 3 local instrument. And practitioner Mitzi Racine has worked with the Montana-Wyoming Tribal Leaders Council since February of 2007. She's been implementing the performance standards assessments with tribes since then. Start talking about what the performance are, and I'll be skipping a few slides just for the sake of time, but I hope that they'll provide some useful visuals even if we don't get to them. So, by showing a pic of what the new version 3 assessment instruments will look like, and you'll see there's the local, state, and governing entity assessment. For one, this is actually the implementation guide, but the assessment instrument will look a lot like this. So, what are performance standards? Well, it's a self-assessment tool communities, states, and governing entities can use to assess their public health system. It's a STEM assessment tool to both strengths and weaknesses in the way that the system is delivering the 10 essential public health services. And these services are based on these 10 essential, the performance standards are based on these 10 essential public health services. and they're examining how they're delivered by state or local public health systems. So a question for you all to type in chat is, what other initiative is also based on the 10 essential public health services? Second, the performance standards are assessed public health system, which includes all public, private, voluntary entities that contribute to public health activities within an area. The performance standards provide ideal standards of performance, not standards that meet the basic minimum. That way, the public health system can measure where they are, and because the performance standards describe optimal levels of performance in the 10 essential public health services, systems can draw ideas and opportunities for the performance standards tool. And last but not least, the performance standards can guide and help users identify opportunities for quality improvement using the optimal levels of performance description provided in the tool, and also using the results to select a QI project for improvement, for instance. So when I say the performance standards, sometimes I say tools and sometimes I talk about performance standards and materials. I just wanted to all be on the same page about what the performance standards, tools, or materials are. So when I instruments, it's the same thing as the assessments of standards that are looking at your system. It's also, materials also include facilitator guides, implementation guides, reporting tools to help you analyze the results for each of the 3 assessments. And the whole, these are to identify partners in the public health system and merge together for health assessment and improved planning on an effort to improve the public health system. Let's skip over this slide, which is geared towards local health departments, and talk a little bit more about it through this slide. Talk about the connections between the performance standards, FAB accreditation, quality improvement, and performance improvement. And close. It looks like a lot of you have taken the polls now, and I'm just going to go look at the results. People are very familiar with FAB standards. Great. And a lot of people are interested in doing the low assessment. Some people know, and a lot of people have seen but not heard or not used the performance standards before. With this part, let's talk about these connections. So, how the performance standards assess the system. The accreditation journey assesses the health department. And know both the performance and the FAB standards. Let's see if anybody wrote it in. I don't think so. Not, oh, FAB, public health accreditation, yes. FAB standards are also based on the 10 essential public health services. We also talk about the performance standards as a part of a community health improvement process. FAB standards and measures. The standards are the required level of achievement that a health department is expected to meet. And the performance standards are part of a community health improvement process. But what's interesting is that the FAB standards and measures also from the performance standards. And performance standards version 3 drew from the FAB standards, so they're mutually reinforcing each other as they develop. And of course, the partners are part of that community improvement process, including health assessment and improvement planning. And those, in addition to strategic planning, are part of the prerequisites to apply for accreditation. Now, preparing for accreditation can lead to quality improvement and performance improvement to strengthen health departments and better prepare them to achieve FAB accreditation. And core performance standard, part of the health improvement process, is a required part of accreditation. So in turn, it's all working together, all interconnected, and all these roads lead to quality improvement and performance improvement. I have this slide showing the connections between the 10 essential public health services and the FAB domains, but I'll provide it just in case. So let's talk about how the performance can be used in at least 3 ways to support applying for accreditation: through meeting FAB standards, 2, documenting contributions to the public health system, and 3, helping health departments identify QI opportunities. So, implementing the performance standards, the documentation of the process, and help meet a variety of FAB standards. You'll see that only noting a few standards here where FAB specifically states that the performance standards can be used as a tool. But NHO has produced a really nice publication to outline the connection between performance accreditation and community health improvement, specifically with the map with mobilizing for action through planning and partnerships, and the exact FAB standards that could be met using the performance standards tool. And we'll make this available in the archived summary. Here, I want to, now that we know what the performance standards are, how they're connected to improvement accreditation, I want to just say what some of the components of version 3 will be. So number 1, they are simpler terms to use questions in a more straightforward manner to system partners. They're not so much voting, so it's time to complete about the same time as version 2, but it's more focused on discussion and fewer voting questions for system partners to think about. There's also information to help ensure that the public health system partners understand the public health system instruments are meant to assess, not just the health department. So also updating an overview presentation that you'll be able to use if you want to help orient your system partners to public health system. And it can be used as a tool to identify improvement opportunities for an action plan. And lastly, there's supportive materials to help health departments develop strategic plans and QI plans. There's some great resources for more information available to you. And that, I'm going to turn it to Deb Scholten from the Northeast Nebraska Public Health Department, who has both used and developed the version 3 local instrument. To you.
Thank you. Hello, everyone. I hope it's cooler where you are than where it is here. It's really been a heat wave. I'd like to talk about version 2. I don't have a lot of good things to say about version 2, and thus we went to version 3 as kind of a mandate. And we were talking with the CDC and talking to NHO and complaining about version 2, and I'll tell you why. In 2007, our district had the MAP process, Mobilizing for Action Through Planning and Partnerships. I'm sure most of you are familiar with that. And we did a very thorough job of it, and when it came time to do the local health assessment and governance assessment with our boards, et cetera, we turned to the CDC's performance standards that we are talking about today. And when I did the invitations, we decided to take everyone that would attend up to a beautiful place on the Missouri River called Ponca State Park, just outside of Sioux City, Iowa, where we could overlook the river and have a nice retreat day. Well, a long day. We had a wonderful turnout with a lot of our partners there. We had representatives from some of the in a very rural area, some of the rural EMS squads. We had some businesses, we had some school principals, we had nursing home administrators, we had hospital administrators and local government and city administrators for towns. And so we were just so pleased to see the turnout. Well, noon, several people had left, and by the end of the day, I wanted to go and give awards to those people that had stuck it out, because if you would show my first slide, Lily. Well, had, I think it was 360 some questions, 326 questions that I had to score individually. And basically, there is just no interactive way to do that and get through all the material. And we going through each of the essential services and scoring how we felt that the public health system was doing in our health district. One of the problems we had to was that our health department was only 5 years old, and so I ended up defining most of the essential services for the crowd, and they aren't familiar with our public health jargon, and we're certainly not familiar with the concepts of the 10 essential services and core functions. And so we found that I would describe things and define things, and even though we had prepared as much as we could ahead of time, and so we found that when people scored, like they were thinking, well, you know, Deb's working hard in the health department is full of nice people, and so let's just give them a high score. You know, not realizing that would really not give us valid numbers at the end. And as much as we tried to make that more realistic, because we were a new health department, there is no way we should have scored high on very much. And so after it was over, I just told myself and my staff that I would never, ever put our health partners through that process again, because it was terribly boring. And even though it was a beautiful retreat center, and the food's good too, we just didn't want to have to repeat that. And so in 2010, I was invited to be the presenter at the Performance Standards and MAP training down in Dallas. And well, while I was down there, I told NATO people and the CDC people how frustrated I was with, and a lot of other people were too, you know, using version 2 of performance standards. And I got a call in early 2011 that they're taking a look at re-engineering the process, and I was delighted to be able to be a participant on that work group. So we met in Washington, D.C., and we went through things diligently and really tried to take a broad perspective view of all the different questions that existed, and then tried to simplify them. And Lil gave you a little synopsis of one of the features of the new version 3, but I want to tell you that we really took a lot of thought, and when we tried to put the again aside and use regular words that the normal person who's not in public health would understand, and that was very important for this whole process. We also kept in mind, you know, the accreditation process, because it wasn't around in 2007. It wasn't very advanced. And also, when we go to version 3, and Lil, you can advance that slide now, one of the things that we really focused on was a discussion base rather than the scoring, because we decided to score after we had healthy discussions. We had to make it a shorter process, but it's still about the same length in order to administer. And if you look at this slide, ideas are exchanged and new ones are developed. The people in this slide, I think, are not public health people because they're pretty dressed up for public health people. But we focused on using a facilitated type framework, and many of us are very familiar with the technology of participation facilitation process, and so a lot of us were using that as a mindset of how to generate the focused conversations throughout the design of the questions that we were asking. Then the facilitate guide and the implementation guide were developed too, and there were a lot of delays in the unveiling of version 3. We had hoped to use it in May of 2012, but it came out about a year later. So, and one of my colleagues in the state have used it. They were a pilot project, and so I got a sneak preview of what it would be like, and it really, the partners were so pleased to be able just to come and discuss the issues and the public health activities and different features of each of the essential services. So I will be happy to answer any questions when we're done. The version 3, I think, is a huge improvement, and so I'll turn it back to Lil so we can keep on schedule here.
Deborah, this is Lil. I'm going to turn it over to Miriam from NACCHO to do a show and tell of where the new instruments and materials are for the local assessment.
Thank you, Lil. My name is Miriam Taub. I work at the National Association of County and City Health Officials, or NACCHO. And as Lil said, I'm going to show you all how to access resources around the performance standards for the local instrument. So I'm going to go ahead and share my screen and show you the magic of technology will work. So I'll be seeing my screen right now. And a few slides earlier, Lil had a link on the NACCHO website where you can find the performance standards materials. I'm also going to show you another way to navigate. If you go to the NACCHO website at naccho.org/maps, map page. And our performance standards resources are in our map clearinghouse of resources, which you'll see on the right-hand side of the screen. And note that we have resources for all phases of the map process, not just for conducting the performance standards assessment. So if you're a health department or your system is looking at implementing MAP, I'd encourage you to check out the clearinghouse to see some of the resources we have available. But for today, we'll look specifically at, in Phase 3, at the local public health system assessment. And find all of our resources around the performance standards. I'll note that right now, all of the resources on this site are for version 2. We're working diligently to revise the website so that it will all be updated with version 3 materials. The language will be updated to reflect the changes to version 3. And of course, you'll be able to download the version 3 instrument as well. Just to walk through some of the resources that we have available on this page, a number of resources on basics, understanding the performance standards. So many of these resources were created by local health departments, and then contain some background information on the performance standards and how these local health departments did use these, who conducted version 2, have used these background materials to help inform and educate their partners about the performance standards and about the 10 essential services. Then of the website has a number of resources around how to get started with the process, including sample invitation letters, how to sort of start thinking about how you'll organize the assessment. It's where the local instrument facilitators guide version 2 is right now, and version 3 will be very shortly. We have some resources around, again, orienting your partners, making sure that everyone's up to when you're conducting the assessment. And of course, we have resources on actually conducting the assessment. So we have a number of resources here. This is where the local instrument will be posted, and as you can see, if you'd like a draft of it, you can email Mary Kate Alley at mallee@nho.org, and she'd be happy to send you a draft. When the instrument is posted, it will be posted here. We also have a number of PowerPoint slides and other resources, again, from local health departments who've conducted the assessment to help you think about how you might conduct it within your public health system. There's resources around how to present the data that you collect as part of the assessment. So that includes example reports, scorecards, summary worksheets. Again, examples of ways you can think about when you're presenting your results. And of course, very important, some process evaluation tools to help you do process evaluation of your assessment work, as well as some additional resources, including a fact sheet on the connection between MAP and the performance standards, recording of a webinar version 2 that NACCHO did a while ago. That's 90 minutes long, and you can hear from some local health departments about their experiences around conducting the performance standards assessment. Just some of the resources that I quickly highlighted that we have around conducting the performance standards assessment. Again, this page will be updated very soon with version 3 and with all the with updated resources and language to reflect the changes to version 3. And again, if you would like to see the draft version, you can email Mary Kate directly. I'll note before I turn it back over to Lil that NACCHO staff does provide technical assistance in implementing the performance standards as well as, of course, the MAP process. And so if that is of interest to you, you can contact Mary Kate. You can join our MAP network, which is mapnetwork.naccho.org. And on MAP network, we have some wonderful MAP navigators, and these are folks who have extensive experience with MAP and support MAP in their communities and are open and willing to provide assistance to other health departments to help them implement MAP as well. So hopefully you will take advantage of those resources to assist you not only conducting the performance standards assessment, but aspects of the MAP process as well. And I'll turn it back over to Will.
Miriam, and next we have Denise Pavletic from the Assistant for State and Territorial Officials. Denise, yeah?
I'm Lil. Can you hear me? Great. Thank you. So yeah, my name is Denise Pavletic with the Association of State and Territorial Health Officials. I am the lead person here for the state National Public Health Performance Standards. There is a slide in your slide deck with my contact information. So feel free to reach out to me if you are a state health agency looking to do the state system assessment. I just wanted to take a couple of moments to show you around our website and show you how to gain access to the new version 3 materials. So you should all be seeing the ASTO home screen at this point. Lil, can I just confirm that that's what you are seeing?
Yep. Sure.
Okay. So if you go to, if you look up here, it's just www.asto.org. We'll you to our home page. And then from there, if you click or just hover over programs, you then click to I'm having some problems here with my accreditation and performance. Sorry about that. Click accreditation and performance link, and that's our landing page. And then you will see here in the center the link to bring you to the National Public Health Performance Standards. And our version 3 has been released. It is up on the web. So I'm going to click on that and you to that landing page. You'll see there's some background information on the performance standards, and then if you scroll further down, you'll see the section on the assessments. So we do have the version 3 assessment materials posted. As Lil was talking earlier, When we talk about the resources, or we talk about the instrument and the tools, we're referring to not only the instrument itself, but the implementation guide, as well as the facilitator guide, the glossary, and all other resources related to that. So I'm just going to click on the state assessment at this point, just to show you what will happen. I'll click on that. We have a very, very simple registration form, and we won't divulge your email to anyone in the public, but this is just for our internal tracking purposes, so we can find out who is downloading the instrument. We just require that you put in your name. Your agency name is optional, and then your email address is also required. And then if you click on Submit, it will bring you right to instruments. And so you've heard, in the beginning, you heard Deb talk about some of the improvements for version 3. I'm just going to scroll here to the first essential service. I'm going to scroll the introduction and move right into the model standard. Sorry. Here we go. Here's Essential Public Health Service 1. There's some introductory language here. There's a discussion box, and then you get right to the questions. And so if you recall, version 1 had over 1,000 scored questions. Version 2 had over 600 scored questions. I'm happy to report that version 3 now is only around 150 scored questions. So if you are familiar with the other versions, you'll see that you're scoring these questions at the STEM question only. However, there is more time for you to have a discussion with your systems partners around how well the system is doing in each of the areas. So instead of focusing your energy on just getting through the voting, you're focusing energy on the discussion between the partners, and then there's middle time spent on the voting. So I just wanted to bring that to your attention. I'm going to go back to the page again. I would recommend when you download the materials, to go ahead and download all 3 of the main documents, which are the main tools, which is the assessment, the implementation guide, and the facilitator guide. These have all been revamped, more user-friendly. There's less health lingo in there, less questions, and gives you more time to discuss your public health system with your partners. And last, I just want to bring your attention to, we have a facilitator and note-taker training toolkit available for you at this time. The resources there, we have 2 webinars available. One is sort of a part 1 where it's a general facilitation note-taker training. Part 2 is more geared towards actually facilitating version 3. And then you'll see a list of other resources that are available within the toolkit. So the webinar is available along with the slide deck for both part 1 and part 2, as well as the resources. One more note is that we will be building the supporting sources that you heard Nacho talk about, which includes the invitation letters and the thank you letters and all of those. That will be, we are working on those to be consistent with version 3, and we will be posting that very soon. So check back with us on our website. Again, you can contact me directly if you have any questions. We do provide technical assistance to states looking to implement the performance standards. So if you have any questions on that, or if you are in need of TA, please contact myself at the address. Thank you.
Thanks, Denise. And next we're going to hear from Cheryl at PHF, who had a large hand in developing the reporting tools for the local and state instruments. Cheryl, I'll turn it to you.
Great. Well, as Will mentioned, I'm Cheryl DeGuerre from the Public Health Foundation. I'll be showing you where you can access the local state version of the reporting template and how you can enter your scores into it and generate a report. So to score and report spreadsheets, you'll need to go to ps.org/NPHPS version 3. And I'm having a little trouble advancing the slides. Great. Thanks. So to download the spreadsheet, you'll now go to ps.org/NPHPS version 3. And you'll submit a request form by providing the following information: the name of the health department, the type of the organization, the city and state in which the health department is located, and the contact information, which includes the business name, their email, and their phone. You also need to select whether you want to download a local or state version of the reporting template. Once you submit the request form, a new internet browser window will open with the link to the download the spreadsheets. If you have a blocker notification, you'll need to disable your pop-up blocker and resubmit the request form. Once you're on the internet browser page, simply click the download link and save the spreadsheet file to your computer. Next slide. So spreadsheet, the first tab you'll see is the Overview tab, and this has the contents of the spreadsheet and instructions for data entry and report printing. You can denote which tab you're viewing by looking at the highlighted tab at the bottom of the spreadsheet. In the Overview tab, the spreadsheet contains 4 blue data entry tabs and a yellow report tab. I'll begin with the contents and instructions for each tab using the examples from the local template. However, instructions can also be applied to the state version, as the templates are very similar. The spreadsheets were designed for broad use among health departments. The cell text, font, format, and layout are locked. The spreading of the spreadsheet. You can enter or select responses in the appropriate areas of the data entry tab. Next slide, please. Your performance scores, you'll click on the performance score tab at the bottom of the spreadsheet and the name of the health department and do the assessment at the top of the page. This then automatically appears on the report card, and this helps you individualize your reports. You'll select your response for each question by clicking on the select cell to the right of the question and choosing your response from the drop-down menu. Summary notes from the performance assessment, you'll need to click on the Summary Notes tab at the bottom of the spreadsheet and enter your comments under your model standards. It's organized by the following categories: strengths, weaknesses, opportunities for immediate improvement / partnership, priorities, or long-term improvement opportunities. Now, each comment cell can hold up to 100 words or about 500 characters with spaces. So we recommend health departments keep their comments brief or include a complete list of comments as a supplemental attachment to the report. Next. So optional questionnaires included in each assessment. If you completed the optional priority rating questionnaire or the optional agency contribution questionnaire, you'll need to locate the tab at the bottom of the spreadsheet and select your responses for each area from the drop-down menu. Now, when entering your responses into each data sheet, you view your final reporter results directly from the spreadsheet by clicking on the Report tab at the bottom of the spreadsheet. Next. Scores and comments entered in the Data Entry tabs will automatically populate in the Results section of the report or in the appendices. If your department did not complete the optional questionnaires, the corresponding sections within the report will remain blank, as seen in the example on the screen. You can report directly from the spreadsheet tab, or you can save the report as PDF and store it on your computer. The reported basic data in Word format. There must be a starting place. We understand that many organizations will want to create a different slide or images based on the data. And we encourage this. However, we're unable to customize the reports on an individual basis. Any questions the instructions or the spreadsheet, we encourage you to visit phf.org and scan our responses to frequently asked questions. If any questions pursue the actual format or structure of the spreadsheets, please feel free to forward that on to NPHPS-support@phf.org. And I'll hand it up.
Thank you, Cheryl. And these reports they may look a little complicated right now, but when I played around with them, it was so great to have them and such an improvement. So thanks for sharing. Next, we're going to hear from Stephanie Branco from the National Association of Local Boards of Health to talk about the governing entity assessment.
All right, thank you, Lil. Can you hear me okay? Okay,
Sure.
great. Hopefully I'll be able to advance the slide here. Maybe not.
The arrows or the thumbnails?
Yeah, I'm not.
Okay.
Huh, the arrows aren't working for me. Oh, hold on. Okay, there we go. All right, I'm good. Got it now. Sorry about that, a little technical difficulty. Well, I will try to be brief. I know that we're running a little bit behind, but I just want to talk to you really briefly about the government entity assessment version 3. And to start out, I'd just like to go over what is a governing entity. And NALBO, or the National Association of Local Boards of Health, identified this definition back in January of 2013. And essentially, it's a body that ensures the 6 functions of public health governance in a jurisdiction. So just to briefly touch on the 6 functions, in addition to the essential services of which we've talked about being part of these assessments, NALBO has also framed some of our this portion of the governance assessment around the 6 functions. And you can see 3 of the functions here: policy development, resource stewardship, and legal authority. And the other 3 are partner engagement, continuous improvement, and oversight. And just to give a real quick background, these functions have been determined over a period of time. NALBO partnered with CDC and other national partners and experts to really look at what functions need to be occurring in a health jurisdiction that are related to the governing entity. So these are what we've identified as the 6 main functions that any jurisdiction should have their governing entity performing. And not necessarily all governing entities are responsible. Generally, they would be responsible for some aspect of the function, but there may actually be, depending on the situation, all the functions should be performed, but there may be different entities performing it, depending on the situation and legal authority. So what are the benefits of governance assessment? As you can see here, we've identified a number of benefits, and I think basically what it all comes down to when you look at this is really informing the process and allowing your governing entity to decide what can they do in order to make some changes that will benefit their public health agency and jurisdiction. So when you really look at these benefits, it's all about identifying and then beginning to make some changes depending on what you've identified as issues for your community. And looking at the other important benefit, and we've already touched on this, so I'll just be very brief, but again, what connection is to the FAB standards? And the governing entity, of course, cannot be accredited through the FAB accreditation. That's only for the health departments. But 12 is an important component of the standards that relate specifically to the governance entity. So when you're looking at actually performing the assessment, there's an important component of that you can actually look at, and you can identify what are, if you will, sort of the golden standards or the optimal standards. And if your governing entity actually can take the assessment as part of a preparation for the public health department going through the accreditation process, that's what we recommend, because we think it will really help lend support to the agency in successfully fulfilling the standards. And just quickly going over some differences between version 2 and version 3, and I know we heard some commentary earlier regarding some difficulties with version 2, and there was significant changes between version 2 and version 3 for the governance assessment. And part of that really, again, reducing the number of questions. We have also had the same with this instrument. And then somebody mentioned using the right terms and the wording. And what we really found was once we began to really link into the governance functions, we could get questions that were much more relevant for the public health governance audience, and they felt much more comfortable in answering the questions, whereas with version 2 there was a little less comfort about the wording and how the questions were phrased. So we really feel that that's some benefits of version 3, and of course a major focus being that we really do believe now that it is a more applicable to the majority of the governing entities. And then just a little bit about the scoring. This time around, instrument, originally I think version 2 did not include the not applicable, if you'll see on sort of the slide behind, but I wanted to point that out, and here you're also being able to take a look at what the local and state scoring is. But we did have the addition of the not applicable for the governance assessment, and the reason being that kind of gets back to what I mentioned before, legal authority. There may be certain governing entities that may not have a certain legal authority that would relate to the question, so that we would give them the option to be able to say that would be outside their legal authority. Although you could still have legal authority, but maybe would not be participating, and then that would fall under the no activity category. A little bit about the post-assessment process. I know we've talked a little bit about the number of tools that are available. Again, there are quite a few tools available with this assessment also, and they're organized into several sections, as you can see on the screen. And I think the most important thing about this is really to remember that the questions as answered, they're collective answers, and again, there's a lot of discussion built into this process. Also, we have an estimate that it takes about an hour to complete each component, but then will depend on the amount of time that you give for the discussion portion. So just to keep in mind about available out there to do the post-assessment process, which essentially goes from discussing your results to ultimately coming up with some kind of a plan for improvement. And then just a little bit more about the score sheets themselves. This is just an example of what the score sheet looks like. You see the questions for Essential Service 1 through 3 on this sheet. And we do suggest that, again, it's going to be a consensus answer, and that it's often helpful to assign maybe a facilitator or recorder to actually complete the score sheet. And then from the score sheet, this is an example of what a report might look like. And one of the things to note here is you can see, for example, this particular governance entity scored very high on Essential Service 6, pretty high on 2, but when you look at Essential Service 5 or 9 or 10, you can see, just to be able to compare what essential services are scoring higher and what are scoring low. Again, these can help facilitate some discussions around what your example or what your score sheets are showing. And range of scores within the essential service can hopefully provide some insight for perhaps some improvement opportunities, and again, such as you might see around these essential services 9, 5, or 10. And then also, this is another example of a score sheet that comes out of the tool. And what you're looking at here is a breakdown chart which shows the number of times the governing entity used each response. And again, looking at this chart and being able to say, well, what stands out in the responses? Does the governing entity use one of the responses more frequently than other? And then really taking a look at why that might be true. So this has been just a basic overview of what you can get out of the scores, but I think that giving you a couple different options as you're taking the assessment, and then just be able to really have that more deep down discussion and look at your results, and then to be able to determine how you can make some improvements. The final thing I'm going to mention, I don't have a slide for it though, we released the version 3 of the governance assessment, and it is available on NALBO's website, which is at www.nalbo.org, and it is actually right on the front page. There is a link right on the front page, a little box that says we've just released it, and if you click on that, you can click for more information, and the instrument is available. If you have any questions, please feel free to give us a call at NALBO. We're more than happy to provide any technical assistance. And with that, we'll turn it over back to Lil. Thank you.
Stephanie, I'm going to turn it to Mitzi now from a practitioner perspective of implementing the governing entity assessment. Mitzi?
Hi, thanks, Lil. I'm just looking to see. My legs aren't showing up. Oh, here we go. Yeah, I got it. Great. Thank you. Thank everybody. My name is Mitzi Racine, and I'm the Project Improvement Manager for the Montana-Wyoming Tribal Leaders Council, and just kind of going to go over a little bit of our experience in utilizing version 2 and transitioning over to version 3. We've utilized with a couple of tribes the version 3 governance assessment. Just kind of giving us a little bit of overview.
Okay. I'm not quite seeing the slides move. Are you arrows or the thumbnails?
Yeah, and now move for me.
Okay. If you can, I'll take the reins and just let me know when you want me to change the slides.
Okay.
Thanks.
Go ahead. Okay. So here, just to kind of give you a little bit of an idea, the Rocky Mountain Tribal Epidemiology Center serves the American Indian populations in Montana and Wyoming. The Epicenter was established in 2005, funded by an IHS cooperative agreement. Next slide. Really, our program vision and goals here, utilizing the NPHPS, is to provide performance standards for the public health systems and encourage their widespread use, engaging and leveraging national, state, and local partnerships with the tribes to build a stronger foundation for their public health preparedness and promote continuous quality improvement of public health systems. The program is offered to all 10 tribes in Montana and Wyoming. Out of the 10, we have 8 participating, and each tribe can either participate in the project as an opt-in or an opt-out. In the beginning, in 2007, when we started utilizing the NPHPS, funding that was attached to it. So with the previous work that we were doing, we were able to, apply and get the CDC infrastructure capacity building grant, and therefore we were able to offer the tribes some funding. And part of their subcontract is to facilitate this with their tribal health department. So here, what we've done is each of the tribes establish an advisory board or a task force, and this tribal advisory board is responsible for reviewing or editing the performance management documents, developing policies to support performance improvement, advising the public health departments on steps to take towards preparing for public health accreditation. So each of our tribal partners establish some kind of work group or task force. What here is we've established some champion work groups, meaning that we've got some tribes that are way ahead of the others, and so we're utilizing those groups of champions to really maybe give some insight to other tribes on what would to make them do better, or some tactics that would help them to prepare for some of the stuff that we're having them do. We also are fostering workspace improvement that's needed in the Montana and Wyoming communities due to limited infrastructure funding. We also are working on workforce development. We did facilitate a CHR, Community Health Representative work group up in Polson this year regarding so we meeting with them, we're able to meet that need. And also, following best practices, we're including development and modification of health codes and implementation of by public health policy. Next slide. So we're just giving an example of the version 3, new version 3 governance assessment looks like. Nice. And this is just kind of giving us some more information on the partnerships and organizations that help foster the changes in version 3. Next slide. Some of the things that we found that were most effective in the changes in version 3 was the answer response, the not applicable, because really there were some questions in version 3 that just were not particularly applicable for our governing tribal bodies. And so therefore that was wonderful to have that. And really the simplified explanation was also a great part in putting it in the version 3, because it really simplifies the terms of each of those essential health services for the tribes. And so, like the profile results, the score results remain similar with tribes in Montana and Wyoming. We found that, since we started working with the local National Public Health Standards Program in 2007, and then transitioning that to the version 2 governance and then to the version 3, we found still across the board what was the commonality. That essential service number 5 and 6 were low scoring throughout all the tribes. Next slide. And basically what happened with this is that fostered the Tribal Health Code projects. So right now all of our tribes are in the process of either developing tribal health codes or updating their tribal health codes. And some tribes that we have been working with, because of the work that they've been doing in the past, have been able to leverage other funding to help them assist in their infrastructure capacity building processes. So here are some of the lessons learned and conclusions that we've learned since we've been utilizing this, is that health services for American Indians is primarily given through IHS, and which were developed to serve the needs of the American Indian veterans and their families several decades ago. And over the years, we found that really the foundations and the infrastructure need to be revamped, and some even need to be rebuilt. Tribes have really a unique cultural difference that needs to be taken into consideration when we're trying to help develop their public health infrastructure. And even with the limited resources that are out there, we have been able to acquire 8 out of our 10 tribal partners to be able to participate, in the project. Next slide. Just thank you all for participating.
Mitzi, we're going to jump right into Q&A, so if you have any questions, please type in chat. I'm sorry if there were issues before. Just always remember to call in versus listening on your computer. It usually tends to help. My first question goes to Deb from the local health department. How long did it take for you to implement the estimate for version 3 testing?
I'm sorry, say that again. I'm not seeing the question here.
I'm just asking it verbally. It was a question while you were talking about how long would it take to do the version 3 local assessment.
It does take the same amount of time, but the quality is much improved. So we're trying to make it better, but we just weren't able to accomplish that. The questions that we scored went from 326 down to 108, but then the discussion takes up that additional time.
Well, that's about a day?
Yeah. Oh, I'm sorry, yes. It takes a day. You can make it one long day, or you can have it, break it into parts and have maybe, a few mornings in subsequent weeks or afternoons, etc.
Thanks, Deb. Then for Miriam from NICHO, I know that we can contact Mary Kate if we want to access the version 3 instruments, but other people have been wondering when will they be publicly available online?
Yeah, that's a great question. We expect that they'll be online this fall. We are not having a specific date, but I do expect the resources to be online this fall. They're with our graphic designer right now, so they're very close to being completed. And again, keep in touch, and we'll certainly out some communications when they are posted.
Okay, great. I think this would go to for CDC. For version 2, the participant ordered copies of the participant manual from my participants. Will these be available again for version 3? And they found having the participant guides were really helpful.
This is Miriam from NACHO, and I can take that. At this point, we will not be producing hard copies of version 3 here at NACHO. The instrument will be available online.
Okay. Great. Well, if anybody has any more questions that we don't reach, please just contact me or anybody else who is relevant in the webinar here. And I thank you so much for bearing with us through all the different parts of this hour and getting through it. Thank you so much for participating today. If you don't have any more questions, I will let you go. I want to thank especially all of our presenters for taking the time to put their thoughts together around the differences between the two and how they relate to improvement in accreditation efforts. And I'll let you go. Bye-bye.